Hi, this is Dr. David Zahaluk, and I'm here with Mia Bevers, our resident in-house billing specialist. And we're going to continue to talk about things that patients can do to help to manage their healthcare costs while they still get great care. So, Mia, welcome back for more discussion here. Let's start by talking about the difference between a copay and coinsurance. Sometimes that can be confusing.
With a copay, usually all the services are covered under one set amount, and then under a coinsurance is a fluctuating amount depending on what services are provided. And also, a lot of times when you have a copay, you don't have a deductible, and when you have a coinsurance, you do.
Okay. So basically, if I pay a copay to see my doctor, for example, I might pay $35, $25, and typically that's going to cover everything at the visit. The time with the physician, and usually, but not always, most everything they do in the office.
Right.
And then if it's a coinsurance, I might pay a 90-10 or an 80-20. I'm just paying a percentage of what that physician's fees are. I'm just paying a portion of that. It's not a flat fee. It'll vary in terms of what they do. And is it true then that most of the time if I'm on a coinsurance, there's some kind of deductible?
Most of the time, occasionally you run to a warrant, there's not, but most of the time with coinsurance there is.
And I think Medicare is probably a good example of a coinsurance. If it's straight Medicare, it's just 20% of whatever the bill is.
Right.
Okay. And what should patients know about using their deductibles?
As far as what it applies to, office visit or any other medical services and not the office visit, and then also if they have a deductible that applies to their preventative care and versus the sick care.
Mm-hmm.
And then how much that deductible is the big part, because if you don't know, then you might be paying longer than you expect to be paying.
So is it true that in a lot of cases, you can never say never or always with these, but is it true that in a lot of cases for preventative care, there's often no deductible?
Right. A lot of times there's no deductible and no copay.
Okay.
And some of them, in that case, some of them will have a limit though.
Mm-hmm.
So you need to also be aware of if you have a preventative limit, max dollar amount that you can spend on your preventative.
And then for sick care, there might be a separate deductible for the office visit, in other words, time spent with a provider, or it could be separate for the lab or for injections or vaccines or even specialists. So sometimes the insurance will carve out special deductibles for a whole bunch of things, and patients would benefit, right, if they knew which things that they were deductible for.
Right.
Good. And then I guess they also need to know how much their current deductible is so that they can make some kind of budgeting or plan for how they're going to take care of their fees. And then can you talk about the out-of-pocket maximum? Because that's usually a surprise to people.
A lot of times, most of the insurances will have an out-of-pocket maximum per individual or family, and that's where they say, once you've met this amount, we cover everything 100%.
Mm-hmm.
Now, some insurances are including your copays in that, some do not. Your co-insurances are always included in that out-of-pocket maximum if you have an out-of-pocket maximum.
Mm-hmm.
And then now some of them are also included in your pharmacy copays. So it really depends. You just need to check with your insurance company and see if you have an out-of-pocket maximum and how much and what applies towards that.
But sometimes patients are a little bit they've had to stretch to pay their copays and their deductibles, and then they've reached their out-of-pocket maximum, but they don't know it, and they're fear that they're going to have to pay more, but really they've paid all they have to pay. But if they're not aware of it, they may not use services that they need because they're afraid that they're going to have to pay extra. So that's a good point. Okay, so let's talk a little bit about preventative visits. We talked about the deductibles and copays for them, but tell people what they need to know about physicals and preventative visits.
Okay, first they need to make sure if they have that coverage. Most plans do, but there are some that do not. And then also as well as if the deductible applies to that or not, mm-hmm. and how many visits per year or contract year they have available to them, if it's unlimited or if they have one. And if they have routine blood work every year for any particular reason, they want to try to get that all done at the preventative visit, because then it may be covered 100% versus them having to pay out of pocket or pay the deductible.
Exactly, yeah. And so just so I capture that properly, some plans will allow multiple preventative visits per year, mainly only one. And most plans will have a maximum amount that you can spend on preventative. But that could include other things too, like pap smears, mammograms, colonoscopies, bone density, stress tests. Is that right?
Right. Anything that could prevent a future problem that you can screen for now, a lot will fall into that. But the mammogram and the colonoscopies do not count against your cap or your maximum amount towards your preventative.
Yeah. Good. Okay. And I guess the insurance companies in general want you to get a physical because I think it's proven that you have less hospitalization, less health care problems in general, and better outcomes if you get screened for things before they're a problem rather than waiting to take care of them once they're a problem.
Right, and in the end, saving them and you both money.
Yeah, they like to do that. Okay, well, that's it for this video. We're going to have part 3 coming up, and we'll kind of wrap it up with some other key issues. And in that part 3, we'll talk about things that the average, kind of a checklist of things that you can do to keep your health care costs down but still get the best care. Thank you.